So you mentioned a word, you hinted at a word that we picked up on yesterday with Michaela, outsourcing.
Yeah.
And and you called it compartmentalization or specialization. And I'm just going to pick up on those two words very quickly because I'd love to hear what you have to say if we take those two things together and think about what touch really does, which is give us a big picture, you know, view on things. Because I think of the multitude of receptors, because of the functions of touch. So very much inherent to touch is picking up on lots of information,
Yeah.
bringing it together, synthesizing, and communicating. And I wonder if there isn't something that, first of all, here's the bright spark, the Hoffnung, right? The hope
Mm.
is maybe there are little ways in which, even at the averaged out level, we can introduce small versions of touch interactions that don't interfere with, mainstream medical practice, which has to be efficient, right? But which would still provide some more information, more big picture thinking, and more interpersonal connectedness, even for the average.
Yeah, I do agree. I think definitely small steps. I think one aspect is the kind of diagnostic touch, and then the other aspect is more this kind of healing touch, more like the therapeutic touch. I think these are like two different things kind of you have to consider. And I think you're definitely right that there's in one touch there's a lot of information, which this kind of multisensory integration, so it kind of gets integrated within your brain, but it also gets paired with your experience. So that's kind of sensory, and then it gets modulated or influenced by the experience, and not just the knowledge, but maybe also the personal experience you already had in your life. And especially since, I mean, not sure if I still qualify as a young doctor, probably not, like a middle age. But if you have not much experience, yeah, then it's also way harder to actually integrate this information. Yeah, so I think that's definitely something you kind of have to learn. I don't think that like a young resident who barely touched a person in his or her medical school is then like getting the same amount of information from a human touch than someone who has more experience with this. So I think there's a learning trajectory, I think, which is important. And maybe you can, and I think this is a thing how medicine was done before. You had more like this kind of teacher-student relationships. Someone is kind of teaching you, showing you, you touch first, and then you let the resident touch. And this is, I think, how learning happened back then. Now learning is well, first of all, more in books and then more online. So I think there's also less, teacher-student relationship, which also, does not help to implement touch
Or maybe you
because
can speak to that with a little bit more detail in your experience. Um, First as a medical trainee, when you were learning, were you of the old school, or were you already seeing this depersonalization, this less touch? And if it was the latter, if you felt already then that there was less interpersonal interaction, what has made you become the doctor you are today, and we're having this discussion because you believe that touch should be there.
yeah, I do agree. I think in medical school, at least in Germany, I think the whole approach is, and I had debates about this also with the chair of several departments already, is basically to educate physicians, but also researchers. So it's kind of integrated, which I don't think it's my opinion. I think medical schools should first and foremost kind of, produce or educate good doctors and not necessarily good researchers, but it's still kind of the ambition to have researchers as well. And I think we definitely have a trend. And I think, again, for the average, that's definitely a good thing for evidence-based medicine. And touch is at least perceived. It's not very much evidence-based. I think it's perceived. It's like uncontrollable, subjective. So and therefore it's not taught in school, and people rely on the kind of hard facts, quantitative facts, meta-analyses, medication. So I think yeah, definitely. So it's not taught. I think it's more like the opposite. So you learn about personal hygiene. You already mentioned the gloves people wear all the time. Yeah, so I think it's actually de-incentivized basically to touch a person.
And so you that was your experience as a student as well.
Yeah, I think it's more like looking back now with the knowledge I have now. I think I would kind of, phrase it this way. I think during medical school, obviously with less experience, you kind
You
of do
didn't
what you're
know.
told to do. So I think you don't have the kind of the big scope or the big picture there. But I think looking back, it definitely did not, at least it did not incentivize touch then I think it's more the opposite.
So
Although
what?
there are a lot of classes and courses, and they're all kind of called, like, with the Anglicism, hands-on. So there's a lot of hands-on stuff, and that's also what the students actually demand. So a lot of artificial bodies are lying around. So there's specific emergency labs where you kind of try CPR on robots basically, and all this. And people also try to get students quicker in the hospital. So there's definitely, I think, this kind of it's on the one hand it gets more scientific and more like there are more machineries involved. On the other hand, the students are also bored by just reading like papers or just clicking something online. They actually want to be with patients. The question is just, and I think you sent me the question before, what is actually, social touch? What is like touch in medicine? And what is this kind of healing touch? And I think that there might be more touch in medicine in medical school right now because it's demanded by the students, but that is not necessarily like a healing touch. It's more like you put needles into people or something. So which is still a touch, but it's a different thing, and it only serves the purpose to basically gather more data.
Okay.